Hello everyone, and welcome to today's Explainer. You know, navigating the world of fertility is tough enough, but when you're suddenly hit with an unexpected medical diagnosis, well, it could feel incredibly overwhelming. So today, we're going to take a deep breath and walk through a very specific, often anxiety-inducing topic, and that's ectopic pregnancies. We're drawing directly from the medical experts at ART Fertility Clinics to bring you this supportive guide. Our goal is to give you clear, reassuring, and clinical facts. Let's dive into this together and take the mystery and hopefully a whole lot of the fear out of this condition.
Here's our roadmap for today. We're going to cover what an ectopic pregnancy is, recognizing the warning signs, diagnosis and next steps, understanding your treatment options, and finally, we'll talk about the impact on your future fertility.
All right, Section 1. What exactly is an ectopic pregnancy?
At its core, the word ectopic simply translates to out of place. So, an ectopic pregnancy happens when a fertilized egg implants somewhere outside the main cavity of the uterus. The vast majority of the time, this happens in the fallopian tubes, which is why you'll often hear people call it a tubal pregnancy. And because the embryo isn't safely in the womb, it unfortunately just can't develop properly. Obviously, that is deeply disappointing news to receive, but understanding the actual mechanics of how it happens is the very first step to managing it safely.
Let's look at how this differs from a typical pregnancy. Usually, sperm fertilizes an egg right inside the fallopian tube. Then, over the next 3 to 4 days, your body's smooth muscle contractions naturally kind of sweep that tiny embryo down the tube until it reaches the safe haven of the uterine cavity. But with an ectopic pregnancy, there's a roadblock. Damage or a blockage in the tube actually prevents the embryo from making that journey. It basically gets stuck, and implantation mistakenly happens right there in the tube. Sometimes, though it's pretty rare, it can even implant in the ovaries, cervix, or abdominal areas.
Moving right along to Section 2. Recognizing the warning signs.
Catching an ectopic pregnancy early is absolutely crucial because it significantly reduces the risk of medical complications. Now, initially, you might feel all the standard signs of pregnancy, but there are specific red flags we need to look out for. Pay close attention to combinations of these symptoms. For instance, a positive pregnancy test paired with constant brown spotting is a key indicator. You might also notice irregular vaginal bleeding. It could be lighter or even heavier than your normal period. The more severe signs to watch for include sharp, piercing abdominal or pelvic pain, unexpected high rectal pressure, or feeling dizzy and faint. If you have a positive test and experience these things, that's your signal to call your doctor right away.
A question that brings a ton of anxiety to patients is this. Is this my fault? Is it genetic? Was I just born with a predisposition to this?
The incredibly reassuring answer is no, this is not a genetic condition. Family history alone doesn't significantly bump up your risk. Instead, the risks are tied almost entirely to physical damage or scarring inside those fallopian tubes. This damage usually comes from a history of pelvic infections, like chlamydia or gonorrhea, or other underlying tubal diseases. Now, if you've had a previous ectopic pregnancy, your risk for another one is elevated. Other factors include endometriosis or exposure to a synthetic estrogen called DES. So, the biggest takeaway here? This is a mechanical issue, an anatomical roadblock, not some genetic flaw you inherited.
Section 3. Diagnosis and next steps. When you go in, your doctor is basically going to step into detective mode, putting together the pieces of a puzzle. First, they'll review your medical history and ask about your last period. Then, they'll run blood tests to measure your HCG levels. That's the pregnancy hormone. In a typical pregnancy, HCG rises incredibly fast. But in an ectopic one, doctors often see a really sluggish, suboptimal rise, sometimes paired with low progesterone. They're going to combine this blood work with a pelvic ultrasound. If your blood says you're pregnant, but the ultrasound shows a completely empty uterine cavity, well, that points to an ectopic diagnosis. They'll also do a physical exam to check for specific abdominal tenderness.
Now, sometimes the ultrasound and blood work don't paint a perfectly clear picture. In those cases, doctors might use a tool called a laparoscopy. Don't let that medical jargon intimidate you. It's simply a minimally invasive procedure where the doctor uses a tiny camera to evaluate your abdomen and directly look at your fallopian tubes. It just helps them confirm exactly what's going on, ensuring they keep you safe and get the diagnosis right.
Okay, Section 4. Understanding your treatment options.
When patients hear the word ectopic, a lot of them immediately brace for major surgery. But is that always how it goes? Can it actually be treated without going to the operating room?
Yes, absolutely. Depending on how early it's caught, there are 3 distinct paths. Path 1 is called watchful waiting. This is for very early stages with low HCG, basically letting the body resolve it naturally. Path 2 involves a medication called methotrexate, which safely stops the embryo's development without any surgery. And then Path 3 is a laparoscopic salpingostomy. This is a minimally invasive surgery used before tube ruptures, where doctors carefully open the tube, remove the tissue, and gently leave the tube itself intact to heal.
Now, a quick but very important note. If you and your doctor go the medication route with methotrexate, it requires careful monitoring. You'll stay at the clinic for about an hour after it's administered, and you might have some side effects like nausea or drowsiness. But here's the absolute biggest takeaway. You'll be sent home to wait for your next blood test in 5 days. If you feel any severe abdominal pain during those 5 days, you have to go to the hospital immediately. That pain could signal a rupture, which is a true medical emergency.
Section 5. The impact on future fertility.
Once the immediate medical danger has passed, the very next question almost every single patient asks is, does this mean I can't have children? Does this cause infertility?
The clinical facts offer a tremendous amount of hope here. Yes, an ectopic pregnancy might affect your fertility, particularly if a fallopian tube was severely damaged or had to be removed. Your chances of conceiving naturally might go down a bit. However, the vast majority of women go on to successfully achieve a healthy pregnancy afterward. Depending on the health of your remaining tube, you can absolutely conceive naturally or with the help of assisted reproductive technology like IVF. Your dream of building a family is still very much alive.
But what about the chances of it happening again? Well, women who've had one ectopic pregnancy have roughly a 10 to 15% chance of experiencing a second one. But let's flip that statistic and look at the bright side. That literally means there is an 85 to 90% chance that your next pregnancy will not be ectopic. Your doctors will just monitor you super closely during early pregnancy next time to make sure everything is exactly where it needs to be.
And even in the worst-case scenario, say ectopic pregnancies keep recurring because of severe tubal damage, you are still not out of options. Modern medicine is pretty incredible. Doctors can actually perform a surgical procedure to safely block the fallopian tubes entirely. This completely neutralizes the risk of another dangerous tubal pregnancy. From there, you can pursue a healthy, beautiful pregnancy through IVF treatment. IVF bypasses the fallopian tubes completely and safely places a healthy embryo directly into the uterus.
Look, an ectopic pregnancy is a difficult, truly heartbreaking detour, but it is not the end of the road, not by a long shot. With careful monitoring, swift treatment, and the amazing advancements in fertility care at clinics like ART, your options remain wide open. So, armed with this knowledge and a medical team that truly supports you, what will your successful path forward look like? Thank you so much for joining me for this explainer. I really hope this guide brought you some clarity, some comfort, and the confidence to take your next steps. Keep learning, keep asking those great questions, and take good care of yourselves.